So this video will going to give you a lot of information, makes thinking. That's the thinking process is more important. A lot of people want to come down to learn my technique. And number one, I'm trying to tell you, my friend, my colleague, you have to think. You have to be wish. Make the wishes bigger, right? Then exercise, then you can get it. Good morning or good afternoon, wherever you live. Thanks for watching my video. So today is the 27 unit, the LISI Cosmic Process, which is full mouse cases, which is we made a beautiful job. Would like to talk to you the why is difference compared to any other laboratory, why I approach that kind of directions. So this video we're going to show you the anatomy, tooth shape and contour. Right, the central, lateral, canine, premolar, and molar, right? So all the time mirror image in between this left and right side compared to the occlusion too. Trying to get this better set up the vertical dimensions, VOD, which is abbreviate, and color, and textures, and level of the horizontal line, and their side view. So think about it from the before, and who has a lot of discoloration, the one dentition, and then they want to improve their smile. So we say there's a lot of communication between the doctors and patient. They talk quite a bit regarding the shape, regarding the color, regarding the final image, what expect, so they can use a digital image or whatever. So most of the time they had three good components they must discuss together between the doctors and patient. Number one, color. Okay, what color will be? So color will be light. What do you mean light? How much light? I mean refrigerator, white, or a little bit wider than white, or a little bit darker than white. So we do have a shade guide. They're using the BO or OM1 or B1, whatever. So we have to choose it. Not only choose the dentin color, we're using the more translucency, more natural lifelike restorations, which is everybody looking for. But hard to describe what is a natural tooth from the old version and new version. What I see from my 3-decade experience, people like the white, but medium value. You know what I'm talking about? The value meaning the too white, this is too low value, and this kind of things too high value. So in between, make the bright color, and with the subtle translucency and the enamel, and then not only color, but we're talking about shapes, the detailed shapes surrounded by central, lateral, canine, premolar, and molar. As I said, it's like more signature cases, which is my touching. So what I see, before I see the cases, we all the time meditated, meaning I want to look at it, what look like, what is the previous tooth look like, right? And then I discuss it with the doctor if they want to. And then after that, we mount it. After we mounted the cases, and we just evaluate it. What do you mean evaluate it? So preparations, tissue design, right, and contour. Check the occlusion is right. So that's the most important thing. So I really care about the two things, meaning longevity and aesthetic. Previously, I talked about the three different things. Once I said the color, right? So I explained about the color. And the second, about they most worry about what look like. Shape and contour is longer, or square or round square, or pointy, those kind of things. Number three, and we all the times thinking about the communication. There's three components. What I said, the last three communications, we all the time talk with the doctor, patients, laboratory, triangular shape. We communicate together in order to to finish it, maximize it, the full mouth restorations, and then we deliver to the patient, right? I'm not selling only restoration, but also I'm selling about their life. That's the key, right? You ask me, that's why I'm trying to represent to you. Not only I make the teeth, I'm selling their life. Just retreat it. For example, this gentleman is about 50 years old, right? Around. I'm not going to tell you the exact age, but I'm trying to give you his smiles back when he was 25 years old, 30 years old. You know why? That's why I'm trying to give you the useful looking, right? That's what I need, what they need. So he can get the maximum confidence in his life. So I want them to finish that one at least 20, 30 years. This will be 85 years old, something like that. That's good to go. Thanks for watching my video. Please subscribe it. We're really hard working for the video for good educations. Thanks very much. Appreciate it. Have a wonderful day. Thank you.